We know from the science that the key predictive factor of a child's long-term health and well-being is the number and quality of relationships that they have in their life. And so when we historically took kids out of their community and out of their home and brought them into one of our centers, we were removing them from those relationships that are key to their long-term success. In the new model, we're taking the services to them and embedding them within their world. But it's always upon their request, and it's with humility and cultural awareness. It's important to note that the transformation has taken place after really 3 steps. 1, deep listening to the community and families that we serve. And 2 is really looking at the science. What does today's science say is best practice? And 3, looking at other national models about what is sustainable and scalable. And so at the intersection of those 3 things, we came together, and that's what led us to build the continuum of care that we have today. We have a mental health care crisis in this country. We know that 90% of brain development happens in the first 5 years. Yet as a society, we only invest 14% of our investments into that age range. Instead, we invest much more later in life when we're paying for the repercussions, having not invested in prevention and early intervention services. You know, honestly, the health and human service system is failing kids and families and has been for a very long time. If you look at any outcome or any indicator of success for kids and families, it's getting worse, even in one of the wealthiest communities in the nation. So Childhaven has really ambitious goals for the next 3 years. First, we want to double the number of kids and families we're serving, but do so where they live, learn, and play. Second, we want to work on workforce development. We need to bring more people into the field, and especially BIPOC people who more resemble some of the kids and families we serve. And third, we want to partner with others, organizations within our sector as well as other sectors, in order to come together and drive better outcomes for kids and families. So in a very short period of time, we've gone from 1 service line to 14 service lines. And what's cool about that is we've expanded not only the ages that we've served, but the intensity of the services that we provide. The great thing about that is every single family is getting exactly what they need when they need it, as opposed to a one-size-fits-all model. On the other hand, it doesn't matter how big our continuum of care gets or how big Childhaven becomes, we will never be large enough to truly bring care everywhere. To do this, we partner. We partner with parents, we partner with other organizations, we partner with corporations, and we partner with you, our community, that enables our work to happen. I'm proud to be a part of an organization that is constructively dissatisfied with the status quo. We have a long way to go, but I am confident that we are on the right track. And with the support of our community, we can better address the systemic issues that plague our children, families, and communities.